What an honor. I am so happy to be with you today. Thank you to the leadership of our college and our university. Thank you to the distinguished faculty, my colleagues in the back. To the family and friends of these incredible students, we are so happy to have you in the creek. Welcome. And we're so proud already of the next generation of leaders that are sitting right here, as I know you are. But to all of you students who are about to don these coats, the rest of my remarks are for you. Everybody else can listen in, but it's for you. When I was first invited to speak at this white coat ceremony, I immediately thought of a movie poster that was on the wall of my bedroom when I was a young teenager. Now, this is a bit of a leap, so stay with me. The movie was Rebel Without a Cause, starring James Dean. Now, don't get it twisted. This was before my time, too. I don't know if you notice how the dean really leaned to. He has decades of experience. What are you doing? In fact, this fall makes exactly 70 years since the film was released. But this talk has nothing to do with the movie. In fact, to this day, I've never watched the film. The reason that poster was on my wall, because James Dean, this dude was the epitome of cool. I know most of you who will be putting on coats have never even heard of James Dean, but I bet some of your grandmothers have. Any grandmothers in the audience with us? All right, now look around at them. They're smiling and they're blushing. That's what I'm talking about. He was that kind of cool. And on this poster, he was leaning against a brick wall. He had a cigarette in his hand. This is before I was a public health guy. His cigarette in his hand, thumb in his pocket. He was making this brooding, devil-may-care, kind of eyes half open, lips pursed. I mean, it was a duck face. It was basically the original duck face. He was wearing a white t-shirt and jeans, but the whole thing was the jacket. The whole image was this jacket. It was a red leather jacket with the collar popped. He wasn't wearing this jacket, he was served. And when I was asked to speak at this ceremony, I thought of that poster because in our moment, what we need is for all of you to wear these white coats with the attitude of James Dean. Let me tell you why. There are so many ways in which the world of your careers will be wholly unlike the world of your mentors. If you are to become the health professionals that we need, you must refuse to conform to the patterns. You must refuse to conform to the molds of the past. We need a generation of, you with me, rebel healers. Rebel healers who know that the world of healthcare that you might have shadowed is the past. It's not the future. We need rebel healers with the unbridled confidence of the epitome of cool who are ready to take on the daunting challenge of remaking this whole healthcare enterprise. When you put on that coat today, I hope it's with that attitude. And I'm going to challenge you to refuse 3 molds in particular. First, refuse. You must refuse to be a machine. Now, you're going to have access to machines and AI at your fingertips that most of us cannot fully grasp. Within your careers, you'll walk into exam rooms where AI glasses record every word, whisper questions and suggestions into your ear, and draft your notes in real time while you're talking to the patient. PT patients will go home with avatars in their pocket that will coach them through the exercises that you lay out and record with motion capture cameras in their pocket to give you data on what's going on. In rural hospitals, there will be robotic surgical bays that all of a sudden give surgical specialties to communities that have never had it before. This is not science fiction. This is your career. In this world, we might ask the same question that the poet and the farmer Wendell Berry asked. In the last century, when he was facing the death of the American family farm, he asked the question, what are people for? Our programs once trained you to be these diagnostic machines, some version of Dr. House, a medical Sherlock Holmes. But that era is over, or will soon be over. The rebel healers will usher in a new future that centers the art of healthcare. An era in which your most valuable skill sets are learning to be partners in health, where you listen to the patients more than the bots in your ear, where your physical presence reassures patients when the avatars are feeling real thin and hollow. A world where nurses provide comfort and connections as hospitals literally become more robotic. Rebel healers, if you are to become the healers we need, you will use machines, you will not become machines. Refuse to become a machine. But even if you do that, there's still another trap waiting for you. So refuse to be a machine, but also refuse to aspire to be a superhero. Let me tell you what I mean. Moms, dad, grandparents, loved ones, students, as you begin your journey. Programs like ours used to work hard to make you into something beyond mere mortals. Folks who could stay up for 24-hour shifts, who could have all the answers like you had the internet in your brain, who could take on vicarious trauma after vicarious trauma without it piercing the exoskeleton of your compartmentalization. Refuse them. The system pretended like you didn't have limits. We all like to pretend like you were mythical. Refuse that mold. You must insist to remake this healthcare space so that the point of saving time with technology is not simply ratcheting up the pressures of productivity, but rather that any efficiencies we get from tech give us back what matters most, our humanity. No superhumans, humans. The future will desperately need you to bring your full selves, to have real connection and real partnerships with your patients and to the communities that they belong to. And let me speak for just a second as a member, as a representative of that community. We need you to be well. We need you to be rested. We need you to have a life. In March of this year, a study came out from the UK. It said more than a third of providers were so exhausted, reported being so exhausted that it impaired their ability to care for patients. And 1 in 4 said that a patient had been harmed as a result. We need better, you need better, let's do better, make it better. Refuse to burn yourself out trying to be something more than superhuman. Don't be a machine, don't be a myth. But finally, refuse to be ordinary. Refuse to be ordinary. When I think about extraordinary, I can't help but think of my son Miles, who has Fragile X syndrome, and he is truly extraordinary. Fragile X causes a lot of challenges for us: physical, behavioral, intellectual delays, and disabilities. And when my son was only 2 years old, I had the opportunity to travel to the Mind Institute at UC Davis so that my son and I could have a clinical consultation with the world's leading expert in Fragile X, Rhonda Hagerman. Dr. Hagerman and her team dedicated themselves to exploring this thing that few people knew about, had ever heard of, a rare disease that was genetic and complex and definitely not a pathway to fame and fortune. But over decades, Dr. Hagerman was responsible for breakthrough after breakthrough in better understanding the syndrome and the treatment of individuals with Fragile X. So you can imagine how excited I was that we were going to get to see this incredible physician scientist. But y'all, that morning was hard. Traveling with little kids is hard under the best circumstances, right? And that morning, Miles was having a very difficult time in a strange place, an incredibly busy place with all kinds of manner of clinics going on. and I'm sure he could feel my nervousness too, which wasn't helping. So we ducked into a little cafe so that he could get a snack while we waited. And the food helped, and he was doing a bit better as he munched on his little goldfish, but he was still teetering on the edge of a meltdown when a group of white coats walked in. And they were speaking thick accents that were from like Norway or Finland or somewhere like that. And then one of them, a woman, saw Miles and came over to our table. And to my surprise, she spoke with an American accent. And she said, "Well, hi there, how are those goldfish?" And she squatted down and she smiled at my son, Miles. And Miles smiled back at her. And before I could react, he reached into his goldfish bag and he handed a goldfish to her. And I jumped in and I said, "I'm sure she doesn't want any goldfish, but that's super sweet, buddy." But she had already taken it from him and popped it into her mouth. Y'all, don't do that. Don't eat things from dirty little toddler hands. She popped it into her mouth and she said, "It's so kind of you to share your snack with me." And then she looked over at me and she said, "Do you all have an appointment with one of our clinics today?" And I said, "Yes, we feel very fortunate. He has Fragile X and we have an appointment with Dr. Hagerman." And she smiled and she said, "Well, that makes me very fortunate. I'm Rondi, and I'll see you a little later today then." Yeah, I couldn't believe it. The team of docs that she'd entered with were from Karolinska, the renowned institute in Sweden, and they had traveled halfway around the world to study with the very best. And the very best was squatting down, sharing gross goldfish with my son. If you'd like to read more about her, it just so happens that last month, in a little journal called the New England Journal of Medicine, they did a feature on Dr. Hagerman's research. But all the accolades you can find in a Google search about her will never parallel to me, will never trump in my mind the greatness of her in that moment. She didn't need to be a machine. In fact, AI and robotics could never do that. She didn't need to be superhuman. She just had to be authentically human. But she couldn't be ordinary. Ordinary would have been passing us by, not squatting down and having that moment. And that's why, in my mind, she's the blueprint for the rebel healer. So when you put on that white coat today, give us your best James Dean face. Maybe pop that collar. And let the moment of putting on that coat change you. You're not just putting on a coat, you're committing yourself to becoming a generation of health professionals we have never seen before, breaking the molds of the past and leading us into the future as rebel healers.